Your brain has billions of cells. Do you ever think how they communicate with one another? Well, it's the chemicals called neurotransmitters, and electrical impulses or electricity are the two main ways brain cells communicate with one another. What happens is when you have Parkinson's disease, the brain cells are dying. They're dying slowly. And I have this movie going on behind me, which is kind of showing you slowly the brain cells are dying. You still have the electrical impulses that are going on. You still have chemicals that are being released. A person has to lose over 50% of the dopamine-producing cells and 80% of the dopamine before they actually have symptoms of Parkinson's disease. Here I'm showing you an individual cell where the dopamine is being released. Some of it is being reabsorbed, some of it is being metabolized. The bottom line is the dopamine that is being produced is getting less and less. And because of that, the communication between the cells is getting affected. So what would have been a normal movement, just walking down the street, makes it feel like a person is driving with their car brakes on, or actually walking in a foot of snow, and every step being a struggle, and at the same time trying to balance their walking. So how do we treat Parkinson's disease? I told you the most important chemical that's affected in Parkinson's disease is dopamine. So we can either use chemicals to replace the dopamine, or like I said, the other way the brain cells talk to one another is electricity. So in some form we can reproduce this electricity in the brain and help with the symptoms. One of the most common ways we treat Parkinson's disease today is by using levodopa. Levodopa goes in the brain and is converted to dopamine, the chemical that is reduced in Parkinson's disease. When we first initiate this chemical, the patients have a very good control of their symptoms. However, with long-term use of these medications, patients start having time during the day when the medications are working and times during the day when the medications are not working. Think of it about getting a new cell phone. When you first get your cell phone, you recharge it. The battery may last you for 2 days before you have to go back and recharge the phone. Well, a year later, when you put the same battery, it may only last you for half a day. And pretty soon, you're not sure if I go out, will the battery last me or not? I need a car charger kind of a thing. Well, unfortunately, that's what happens with Parkinson's disease. Each dose, which was initially predictable to last for days, now it comes down to hours. And that's not the only thing. It becomes more unpredictable. That one dose may last for an hour, the other dose may last for 3 hours, and some doses may not actually work at all. Just like your battery, at times you charge it and say it still didn't charge. So what do we do once a patient gets on this roller coaster of symptoms? Their medication's working, not working, their day becoming unpredictable, they're not sure if they go out for dinner, will they be able to walk back to the car? Well, those were the challenges we were facing, and we had to look at other forms of therapy to help. And that's where we turned to surgery. Well, surgery is nothing new for Parkinson's disease. We looked at it back in the 1950s. The challenge at that time was that the patients actually came home having more problems than before they went in for surgery. And around that time, we discovered levodopa. So we said, okay, we have the final treatment for Parkinson's disease. We don't need any other form of treatment. Well, after a few years, we realized, yes, levodopa works very well. However, after a few years, this roller coaster of symptoms come on. Patients' medications work, they don't work. The other challenge that happens over long term is patients develop dyskinesias. What are dyskinesias? These are involuntary movements. And any one of you who sees television has seen Michael J. Fox on television having these involuntary fidgeting movements. These movements could be pretty minor, not affect them, or they could be severe enough to actually make them fall out of the chair. So once these motor fluctuations, that's the symptoms being on a roller coaster, and these involuntary movements come on, it becomes really challenging to try to keep the patient being even throughout the day. So we had to go back and reassess what treatments we could look at. and that's how surgery for Parkinson's disease was reborn. However, this time, we had better technology, we had better computers, we had better brain scans, and we understood the brain much better. So our results were also better than they were the first time that we looked around. The first case of deep brain stimulation surgery was done in France by Dr. M.B.B.S. He actually used it for tremors. And here I'm showing you a patient who has real bad tremors, who can barely hold a glass of water, barely can do anything. Dr. M.B.B.S. came to Kansas City in 1993. And actually, I saw a video pretty similar to this one. And as you see, when I turn it on, the tremor goes away completely. And I'm looking at that video in 1993, and I'm saying, you know what? Is this really true? And I'm sure a lot of you are thinking the same thing. But that was the case. After you see it time and time over again, this is really magical when it works, and it works most of the time. So what exactly is deep brain stimulation? Well, you could think about deep brain stimulation as a pacemaker for the brain. Just like for heart, we have actually a battery implanted under the collarbone, and the wire is connected, and the tip of the wire is deep in the brain. What this battery pack does is actually provides electricity to a part of the brain. And depending on what part of the brain this electricity is going to, that's how the symptoms are going to get better. And that's the basic concept or the basic idea about deep brain stimulation. Deep because the lead is deep in the brain, and stimulation because we are providing electricity to the brain. Well, remember I kind of told you in Parkinson's disease, patients are on a roller coaster of symptoms. Their medication's working and they're not working. So here I have Bill. When Bill gets up in the morning, he hasn't taken his medications. He takes his medications. It takes a while for the medications to start working. So until his medications get going, he's struggling with the tremors. He's very slow. He's very stiff. It's a challenge even trying to get up. In fact, he cannot even get up by himself to go to the bathroom. He actually needs two people to actually just make him stand up, and walking being a great challenge. Well, when he takes his medications, that's levodopa, the medications start working pretty good. In fact, they kind of overwork because he has developed the involuntary movements. But at least it makes him functional. He can still move. His movements are much more fluid, much more easier. And now he can get up and walk without any difficulty whatsoever. The challenge for him is that he doesn't know when his medications are going to work, when they are not going to work, and how long each dose may actually last. So Bill actually underwent deep brain stimulation surgery for Parkinson's disease. So what I'm showing you now is that he hasn't taken any medications, so think about the first video, but both his devices are on, and they are on throughout the day. And you'll pretty much notice not only his movements have improved, but he's also much more animated. He's happier. He knows what the day is going to be. He doesn't have to think, will I be able to get up and walk to the bathroom or not? Because he knows he will be able to get up and walk. So this roller coaster of the symptoms that patients have evens out, and they don't have to worry about their motor fluctuations and dyskinesias. I can tell you without doubt, in the last 20 years, this has been the most revolutionary treatment for Parkinson's disease. Unfortunately, deep brain stimulation surgery is only helping with the symptoms. The underlying disease process is still getting worse. Well, initially, only 50% of the dopamine cells were lost, but over time, more dopamine cells are being lost. The other symptoms catch on. The balance gets affected, the falling comes on, maybe the memory may come on too. So then it again becomes a challenge. This is not a cure for Parkinson's disease. Our ultimate goal is still finding a cure for Parkinson's disease. Today, we can use deep brain stimulation not only for Parkinson's disease, not only for tremor disorders, but also for obsessive-compulsive disorders and dystonia. It is being tested for a number of other conditions like epilepsy, depression, and even Alzheimer's disease. As we know more about the brain, we may be able to treat a lot more conditions just knowing where exactly do we need to stimulate. Think about it. Can someday someone stimulate your brain and control your thoughts and control you? Sounds like science fiction today, but it could happen someday.